Most commonly, if your son or daughter or teenager is diagnosed with scoliosis, they will be given the diagnosis Adolescent Idiopathic Scoliosis. That term idiopathic isn't actually a diagnosis. It's saying we don't know what's causing it. It does not mean there is no cause. The body always has a reason for what it does. Now, in 1968, Dr. Roth may have accurately described what the most common cause of adolescent scoliosis is. Dr. Roth was a neuroradiologist. He published a paper again in 1968 stating that a relatively short spinal cord might be the cause of most idiopathic scoliosis. That was a paper that was relatively ignored until about the 2000s, and in the 2000s Dr. Porter also published a paper and expounded upon the theories, pointing out that if the bones were to grow faster than the nerves, there would be a relative tension on the spinal cord. And an adaptive posture that relieves the pressure on the spinal cord is scoliosis. And I'll show you how that happens. Here's a model of a spine. It's been made to be more flexible than the typical spine model. There's a spine bending forward, there's a spine bending back. This is the pelvis and the back. This is the back of the head, that would be the front of the head. And this wire represents our spinal cord. Now I've run the wire through the spinal canal. What's interesting about the relationship of the spinal cord to the spine, to the vertebral bones, is that the cord is actually behind the part that moves. So when we flex, if you watch the spinal cord here, the spinal cord has to actually get longer. It has to stretch. When we extend, that actually means the cord can shorten. And the most extended, shortened position for the spinal canal is this. If we pull that cord as tight as we can, we have a fully extended spine. Now, Dr. Roth and Porter said that a tight spinal cord would cause scoliosis. But that's not what we see here. We see a spine fully extended like a scorpion's tail, and nobody walks around with their head backwards looking behind them. We have something called the righting reflex, which means our eyes and our inner ear are always going to put our head at level. Now, I'm going to hold the cord tight, and I'm going to add the righting reflex into this model, meaning we're going to hold the eyes and the head level. I'm going to turn it so you can see better. There's what we get. We get a scoliosis. I'm going to let go of the tension on the spinal cord, and you can see it springs up very easily. If I pull down on the spinal cord, we can see we get a scoliosis. From the side view, so you can see that cord action, there's pulling down on the cord, and it leads to a scoliosis. If I relieve the cord, it lets go of the scoliosis. Another interesting observation, a common test that's done to detect scoliosis is the Addams Test. In the Addams Test, the patient flexes forward, and we look to see if there's a high side of the ribs. You can see a slight high side right there. There's a little torsion in that model right now from getting pulled. I'm going to pull the cord tight and flex the patient forward again, and now look at how much rotation we get. Significant rotation in response to the tight cord. Now, if I relieve the tension on the cord, it comes out of rotation. So the most common test for detecting scoliosis, we see this mystery rotation as the patient flexes, and the tight spinal cord is the best explanation for why that rotation occurs. Now there's more evidence that I think should be considered as to whether or not a tight spinal cord explains most of the adolescent idiopathic cases. That evidence is the surgical environment. In surgery, as the spine is straightened surgically, it means the canal must elongate. So we take a crooked spine, surgically straighten it, it means the cord must now elongate. And in surgery, it's commonplace to monitor the cord for the tension that increases as the spine straightens. We had a mother whose daughter had a 80-degree scoliosis, and she was considering surgery. She asked the surgeon, who is a prominent neurosurgeon, pediatric surgeon here, and she asked him, it's 80 degrees, how straight can surgery actually make my child's spine? The answer was, well, we could make all the spines totally straight if it wasn't for the cord tension. So the surgeon is telling us that The rate-limiting factor for what prevents them from surgically straightening a spine isn't the joints, the discs, the ligaments, or even the bones. It's the spinal cord tension. The theory known as Uncoupled Neuro-Osseous Development, that's the term for saying that the bones grow faster than the nerves, put forth by Dr. Roth and Dr. Porter, is consistent with all the literature out there on what could possibly be contributing to scoliosis. It's not inconsistent with any of the literature. It's the simplest and best explanation for what is most likely causing your child's scoliosis.